She spent 15 years treating cancer patients until one day she heard the words herself, "You have 5 masses in your breast." And from that moment, Dr. Su Hwang, a respected radiation oncologist and single mother of 3, went from being the doctor to the patient. Now, we're going to dive into that a little bit and talk about what it's like to be the expert now sitting in the chair, how it's changed her life, how it's changed her purpose, how she treats patients a bit differently now. But before we do, I want to just mention to our friends, if you enjoy this podcast, if it helps you face fear, makes you feel less alone, gives you some motivation, please go on to Apple and Spotify, like it, share it, make sure that you rate it 5 stars, I hope, and continue to share, because this is how it creates a ripple effect so that other women can learn from this wisdom we're learning, especially today from someone like Dr. Sue. And Dr. Sue, is that okay if I call you Dr. Sue? Should I call you Sue,
No,
Dr.
call me
Sue?
Sue.
Call you Sue. And I know we're going to talk about how that changed a little bit, but welcome. Thank you so much for joining us.
Thank you for having me on, Bonnie.
Okay, so I need to ask you this. Who was Sue, or how would I have met Sue prior to this diagnosis? Give me a little bit of Sue before this news.
I think if you met me before this all started, you probably would have described my life as controlled chaos. I have 3 kids at the time. They were 15, 13, and 11. They were at 3 different schools on 3 different baseball teams.
Wow.
I had one of the busiest breast cancer radiation practices in the Orlando area. And then, on my downtime, I would try to see friends. It was definitely a packed schedule that completely felt overwhelming. But when you're in the thick of it, you're like, okay, this is what life is supposed to be like. It's just go, go, go. So that was me
Okay.
pre-cancer.
Okay. So I read a little bit about your story. One of your friends who's also a doctor is like, hey, you need to go get your mammogram. You do. And then the next thing you know, take us to that moment. Successful practice, mom, running, living life. You hear those words. Take us back to that time, if you don't mind.
I think when you do my job, as long as you've been doing it, to get a breast cancer diagnosis is not necessarily the shocking thing because it affects 1 in 8 women. And certainly I know I am not not immune to it just because I'm a doctor. That being said, the shocking part was hey, you have 5 masses in your breast and there's a lymph node. And for someone that does routine mammograms, I go every January since the age of 40. I follow the recommendations I tell my patients. I do physical exams. I see my doctors. And I think knowing that in 1 year I got 5 masses, and the largest was not considered small. It was it was above 3 centimeters, which is over an inch. Um, I thought I was going to die. I knowing what I know about cancer, the biology of it, and some tumors you can watch for a little bit, other tumors they just pop up overnight. And I certainly thought, me being in the latter category, I thought it was going to I thought I was going to die.
So that's where your mind is as soon as you're hearing that. And at the time was, having the expertise that you do, understanding the stage, the type, was that a factor in that? Did you have those details at the time, or was it sort of, this is what we see, now we have to send it out?
I think my expertise, as soon as you become the patient, kind of flew out the window. Because you're right. I mean, when you do this every day and you give patients statistics and the outcomes, and this is the good thing about breast cancer, right? I mean, even for more advanced stages, the numbers are really good. I mean, we are having really good outcomes because our treatments are so good. But then when you become the patient and then all of a sudden, and just to give you an example, I tell patients, hey, 95% outcome, statistically, you're going to do great, right? And as a doctor, you're like totally thinking, how can this patient not be happy with that? But then when all of a sudden you're told 95%, what goes through your mind is, okay, well, who's in that 5%? And all I could think of with the statistic was I didn't look at it from the cup half full. I always looked at it as empty. So my knowledge was helpful because I knew where to go. I knew where to get my treatment. I knew what the treatment would be. I knew what the side effects would be. But on the flip side, the knowledge was not so helpful because in my job, I do see the people that fail, and I know the reality of what it's like to be someone that fails. And I think even though my outcome was good or is good, it's still hard not to perseverate on the other stuff,
When you say fail, what do you mean? Failing in that the treatment doesn't
yeah.
work? That 5%?
Meaning that like the cancer comes back.
Okay. So statistics took on a different meaning to you, which is
Right.
interesting. So let's talk about treatment. I know you worked through your treatment, but yeah. So I guess listen, whatever helps us, helps us. But tell me about how you navigated the treatment now knowing what you know and being on that other side of the curtain, as you
So,
say.
yeah, I think when it came to the treatment, luckily I knew exactly what to do and my friends were all treating me. So, um, I knew my team. I didn't have those uncertainties. And even though, like, for example, I had bilateral mastectomies and implants, most patients will take off 6 weeks because the recovery can be slow. But you need to give your body time to recover. Um, when I had the when I had the mastectomies and I had a great job, my job was so supportive, and they said, "You take as much time as you need. When are you coming back?" And I said, "I'll be back in 2 weeks." Because part of me thought, well, once the pain's under control, I should be good. I mean, all I do really in my job anyway is I counsel patients most of my day. I'm not really running around. I'm not operating. I have a job where I really get to sit and talk to my patients. So I think the practical side of me said, well, why? What kind of recovery could I be doing at home if I'm just going to be sitting there? I can recover at work, sitting here, talking to a patient, like doing that. Remember, I'm used to multitasking, right? And I think for me, the act of sitting, like I was not comfortable with that. The act of doing nothing so your body could recover. It was,
That's not how you're built.
yeah, it's not how it's,
That's okay.
yeah.
Yeah,
So,
that's you
right.
need to do what works for you. And I think so. Let me go back and ask about your boys. So you have three boys, and that had to be sort of what age were they at the time?
11, 13, and 15.
Okay, so now you have to you're supporting them, you're running them. Usually, you're the person running them every place.
Yes.
And now you have to kind of explain this to them about kind of maybe it's uncomfortable talking about that with a boy and it's a mom. I don't know. Um, how was that? How did you navigate it?
Even though they are relatively close in age, it's kind of like you had a high schooler, a middle schooler, and an elementary kid. So it wasn't like being able to sit down with them and have one
Right.
station. I had to break it up based on their level of understanding. And for the high schooler, his friend's mom actually recently passed from metastatic breast cancer. And I knew that would be fresh on his mind as I had to break this news. But what I found is, when I'm trying to navigate these conversations with kids, I just had to really go at their level. So for James, the oldest, it was actually almost like I was talking to an adult in some way.
Right.
Hey, I have this diagnosis. And, I think his first question to me was, are you going to die? Because obviously with his frame of reference and you hear breast cancer, and I can completely understand why his mind went that way. And once I reassured him the best that I could and just said, hey, this is what I do for a living. We're going to treat this. It should be okay. And then he immediately went into like, okay, well, what are the treatments? What's going to happen here? What's going to happen here? He was very, once he kind of got reassured, I would be okay in the foreseeable future, then he could go into like, okay, give me the facts. And rather than kind of sugarcoat it, I just gave him the facts. And he was okay with that. Um, the other two were not quite as straightforward. I mean, with my middle kid, I tell this funny story in the book how like I tell him and he whips out his phone and starts like doing homework, and uh, we never actually had like with James, it was like, okay, like he said the word cancer, how are we going to do it? Right. And then with Sam, it was like, we didn't really say the word. I just kind of told him what was going on. And then his response was, okay, I'll start taking care of myself. That was how my middle schooler responded. And then my youngest, on the other hand, I had to say that was probably the more challenging one because he was starting to ask questions that there are no answers to. Like, well, what's death like? Is it dark? Like, what do you do in forever? Like, do you go to heaven? Like, lots of questions that there just are no good answers to. And you have to really lean into your faith and just kind of gently reassure him, like, hey,
Right.
we're going to go through this together. And I can't. And honestly, I think I remember just being completely honest with him and being like, I don't know the answer to these questions. Um, but, and we'll get through this together.
So, yeah, and I think that's all we can do as parents, right? You try to safeguard them, but you want to be honest, and so you kind of just have to be as transparent as you can.
Yeah.
What point of this journey, they were going to pivot a little bit because this is where sort of the magic happens and the silver lining happens and the aha moment happens, and that's what we talk a lot about on this show. Um, when did you decide, you know what, I'm going to take this and do something with this a little publicly to help others? Kind of, was there a moment that came to you? Did you talk to anybody about it? How did you start that pivot?
I'm typically a very private person, like at least before all this. I am on social, or was on social media, but I was one of those trollers where I just kind of,
There's a lot of them
yeah,
out there.
like
You like to check it out.
I want to see what everyone's up to. But, I will post one picture and it's typically like a birthday picture, but I was never really a person to really throw it all out there. And I'm going to be just completely honest. Like, if cold capping worked and I didn't lose my hair, I don't know whether I actually would have been as ready to put it all out there.
Can you explain to the audience what that is? Because I did see read about that as well, and I had no idea what that was.
So for a lot of chemotherapy regimens, it's really common to lose their hair. And thankfully, we now have a treatment for that where it's called cold capping. And essentially what you do is you put on this like ice cap.
Yeah,
And
fine.
what it does is it freezes your scalp. And as you freeze your scalp, that means the blood flow that goes to the scalp drops. And because the blood flow drops, then the chemo doesn't have the opportunity to get to the scalp, which is why you can preserve hair. It's not 100% effective, as in my case, but honestly, I've seen a lot of patients do it, and we have really good results.
So that kind of spurred you to kind of try to tell folks to do it, or to say, hey, this didn't work for me. Where did that kind of land you?
Well, I think when I lost my hair and I realized, because we are very fortunate in this day and age for cancer care. We have such good supportive measures that many patients can actually get through chemo without having horrific vomiting or just, all these other side effects that would mark a sick patient. Like, we have so many treatments that can actually mask that, right? So for me, my biggest thing was fatigue, but then the other thing was the hair loss. And the reason this was kind of my pivot moment was because I thought if I didn't lose my hair, right, I just would take off a day for chemo and then I come back to work. But if I looked the same, like how I look,
it wouldn't identify. Yeah, people it's not going to define you. No one's going to know. My life is going to be perfect.
Yes.
And it's going to be what it was before.
Exactly. And then after that first cycle and my hair just, because I have really good hair, my hair was.
Oh, you do. You have beautiful hair. You beautiful skin, beautiful hair. I already told you that.
But my hair was so thick that the cold cap couldn't penetrate down into my scalp, which is why I lost it. And as soon as that hair came out, that's when I looked sick, and I did. I was tired, but I really felt okay, which is why I kept going to work. But then when people are used to seeing you a certain way and then all of a sudden you don't look that way. And for me, because a lot of my presence is my hair, I mean, when people notice, like, what's wrong with your hair? What's wrong? And then what's wrong with you? And then that's at that point, I had to make a decision like, okay, do I hide it or do I do something with this? And but I tried to hide it in the beginning. Like I am not a surgeon, but I started coming to work in scrubs and scrub caps because if you walk into the room and they think you're a doctor and you wear scrubs and you wear a scrub cap, well, clearly you're coming from the operating room, which I wasn't. But that was in the beginning.
That was hard. So this was hard for you. The hair loss was
Yeah.
was a hard thing for you.
Yes.
We're talking about a lot of loss here.
And I don't want. I think when a lot of people lose their hair, like their first, what they would first tell me is, I don't want to be vain, right? And initially, before I got diagnosed, I was like, it'll go back. It's not a big deal, right? And then when you go through it, you realize it's not about vanity so much. It's about the fact that like this disease slowly strips you away, like breasts, right? I lost my breasts, and then my ovaries were shut down, and then eventually got my ovaries out, and then while they were down, we got the uterus, like. So I just feel like I'm slowly getting stripped away, and then the icing on the cake was, and there goes your hair, So it was just this total loss of control. As best as I tried to control it, right? I couldn't.
So you're somewhat shy or reserved, right? You're going through this now sort of new experience that you never thought you'd confront. Now you get this courage, or it's scary to put yourself out there. You put yourself out there.
It took me a while to post that first reel because, and I think the other thing that I also, when you asked me what were you thinking to actually put this out there, I had a lot of close friends and their kids, we're all friends. We're all like one big family. And the responses that their kids said to them also made me think I need to be a little bit more public about this, because the kids said, what do you mean she has cancer? She treats cancer. Like, how can a breast cancer doctor get breast cancer? Like, it almost seemed too ironic. And then when I heard it a few times, I started thinking, do women really think that there is a chance that they're not at risk, right? Like, and the joke is like, if you have breasts, you can get breast cancer, right?
Right.
And I think as I've heard this, and even though it was from kids, right? Like the parents, some of my friends actually, even though they were above 40, they never had mammograms. And it was shocking. And then, so between those comments and then the hair loss, I just said, I think there's something bigger. There's some awareness that we need to spread. And because my story, a lot of people do think it's ironic that a breast cancer doctor gets breast cancer. I think the actual irony of it for a lot of people would be enough to open people's eyes and be like, hey, this is something that we all have to be aware of. And even if you're like a man, men have wives,
yes, absolutely,
sisters, mothers. Like, this is a message that I want everyone to know, because breast cancer is such a treatable condition, and I want to get it early in people so we don't have to do it. And I'll be honest, like if I get put out of a job one day, I'll be so happy about that.
Well, you know what? It's interesting because you've given us a lot of great feedback on how far we've come in the treatment of breast cancer. That is great for everyone who's listening to this show, just to know that and have that sense of sort of we've made some great strides. But where did it start to resonate with you at some point to give you the impetus to even go farther? I mean, listen, you've been in People magazine, one of my favorite magazines, wrote a book, you've been on national television. At what point did you start to say, you know what, this is a message worth spreading? It is resonating.
Writing was, interestingly, I never grew up liking writing. Like, I was a math and science person, so people always think like, hey, you must naturally be a nerd. The feedback on the book was, hey, you write really well. Like, that must be you. And I'm like, actually, it's not. When I got diagnosed and I was trying to figure out how to cope, a lot of people told me to journal. And for the longest time, I was always like, what is journaling going to do for me? Like, if I can think it, right? Like, as long as I think it, like, that's good enough.
Right.
But there is something about taking your thoughts and physically writing them on a piece of paper, and that action almost makes it like cleaning your brain out from all these thoughts and all these fears that you have.
Yeah, there's something physical and emotional probably that is taking that and you're now putting it something that makes it more real or whatever. There's a process involved.
Exactly. And so I did that in the recovery. And at the time, I also had a friend who wrote a book, and he was like, you have a very important message here. And a lot of people told me, a lot of people did tell me, like, you have an important message. When you feel better, you really should think about spreading it. Right. So from my journaling, it kind of almost wrote into like an essay about like, because I remember one thing I was writing about was like how this whole experience changed me, what I learned. And I wrote that and I was like, okay, well, let me submit this to the HuffPost because I actually read HuffPost while I'm eating lunch, and I always I really that personal and with stories that everyone.
Yeah,
Uh,
yeah, I know, right?
yeah, yeah, and it was funny because I was like, I I I was like, okay, I know this is like a long shot, but let me just submit it, and they always tell you like, hey, we're not going to get back to you because we get so many submissions,
It's right, right.
and they got back to me in a few days. They said we're going to post this.
My
Um,
gosh.
and then from there, I was like, okay, well, in some ways you feel validated as a writer, right? When like a thing like HuffPost is like, hey, you have a good story. And then my friend who wrote the book actually gave my essay to his publisher, who wife also had breast cancer. And the publisher said, do you want to tell your story? And I said, and at the time I was like, sure. How hard could a book be to write, right? Like,
Oh gosh, please. I know it's very, very tedious and hard.
yeah.
It's a process.
Here's the thing, Bonnie. I think if I knew what went into it, I would have been like, no,
No,
maybe
thank you.
not. Yeah, but
No, it's a tremendous amount, but it is something. There's so much I want to ask you. It is something that you will have forever that really does add so much dimension to your life.
no.
I want to go back. You had said, my message is important.
Yeah.
What is that in one sentence? What is that message?
If I had to say it in one sentence, my message is anyone can get breast cancer, and it's up to you to be your own advocate.
That's great. I mean, there's so much to unpack, but I think that's what you're saying because you are a breast cancer doctor and you got it. So no one is immune to this. All right. So the book comes out. You've kind of been able to expand this, redefine a bit who you are. We talked about who you were before. Now we know who you are after. How has this changed your practice and how you speak and treat patients?
Um, my appointments are a lot longer. They're a lot more intimate. Uh, and they're a lot more focused on prevention. And I'm embarrassed to say, like, here's the thing. When I got trained and you see patients after you treat them, the discussion is, let's examine your breasts. Let's review your mammograms. Let's make sure you're taking your medication. I'll see you back in 6 months, right? And they would ask, and I would get asked questions. Hey, what do I do for exercise? What do I do for diet? And I just say, well, eat less, exercise more. Like, because that was really what I knew. Like, I didn't get education in nutrition, and we didn't get education on cancer prevention when I was in training. And, I finished my training in the 2000s. So it's just not something that I knew how to counsel. And then obviously when you go through it and you're like, oh, wow, this is what the patients are talking about in terms of the hot flashes and the bone pains and the weight gain and the mood changes. And, you're like, I can't believe I told patients to just be like, I'll see you back in 6 months with no real recommendations.
Wow.
And
So an empathy chip really
yeah,
developed because now you walked the walk.
yes. And, I'm very fortunate because around this time, right, and we all think that our phones listen to us. And I'm very happy my phone was listening to me because at this time, as you know, women's health in general is making um, is getting a lot of attention right now, just in terms of menopause. How do you manage menopause symptoms, hormone replacement? We're getting so much attention, but we're also getting more attention on how do you manage menopausal symptoms, which for breast cancer patients ties very closely because whether or not you are in natural menopause, meaning you get older and your eggs, you stop producing estrogen, or whether or not you're in medically induced menopause because of cancer treatment or because of surgery, The fact is the symptoms are the same. So I kind of leaned in a lot to these doctors that were out there on Instagram, and their platform was, we need to educate women about how to go through this because, and we're not going to accept the fact that menopause is you get to it and then all of a sudden you just gotta live your life like that. Like it's kind of like, you hit this age and it's like, okay, well, I mean, this is how millions, thousands of women have done it before you and they were fine. So, you'll be fine. You know, now the shift is you can live a healthy, productive life after you go through menopause. And you need to know these things. And really, it's like the pillars of lifestyle medicine, which are it's based on nutrition, diet, stress reduction, sleep, social interaction, and then like staying away from toxic substances. But now I know I have specific recommendations. This is how much protein you need. This is how much exercise you need. This is the kind of exercise you need. Like it's not just go out on a walk. It's okay, you need a brisk walk. Your heart needs to get to this, or you need to lift weight. So the way I talk to patients now, it's much more informative and it's much more based on evidence. Whereas before it was just like eat less, exercise more.
Now you've gone through it and probably know what has helped you. Soothed some of your pain, maybe helped you, with a mindset shift, maybe helped you kind of. And I would imagine as well. If I'm a woman having breast cancer, I want to come to you because I would just be like, she gets it. She's going to sit with me for a little bit longer. I trust what she's saying, so it's has to have added this whole other level of credibility. But let's talk about purpose because I imagine that person who was running, multitasking, getting from point A to point B, got to do this, got to do that. What has that done for you as a person? How's it changed you?
When I think about what my purpose was before this, purpose was very tied to accomplishment, right? Like pre-cancer is like, okay, doctor, sure. Mom, sure. You know, nice house, sure. It was very, it was like I was running on a checkbook.
And that was your identity
That was,
too. However successful you were in your life in these areas,
yes.
that fed you.
Yeah. And then I think you go through this, and now my purpose is more, how can I impact people to make a difference in their lives? And everyone tells, when you ask me, like, how has my job changed? The fact is, like, I know even before I got diagnosed, my job, like, I have a purposeful job, right? Like, my job is important, but now it bringing, uh, bringing more understanding to patients and me really actually having quality time with my patient where I can actually, like, I know what I say is actually going to make a difference. You started off this session, you mentioned something about a ripple effect, right? And that's where I feel like my purpose is now. It's kind of like to be where you throw that stone in the pond and then you see the ripples. And I kind of want to be that stone where I kind of just tell people, hey, this is what we should do. This is how we should, this is kind of what I feel like we should be doing. And then having them spread it out, because when you help one patient, that patient's going to tell their mom, their sister, their friend, and all of a sudden just one message can be amplified that much louder.
Well, just to acknowledge that, just so you're aware, I get pitched all the time. This person wrote a book, that person wrote a book, but yours came through. I'm like, oh yes, this is definitely like really just resonates to women.
Thank you.
Not only because we all could possibly face this, but listen, you took something and now you're kind of saying, all right, you know what? Like bring me this crazy curveball, but you know what? I have the ability, given what I do, to really make an impact. And so I want to talk a little bit about your book before I wind things up a little bit. Tell people about that book, where they can get it, and what they can expect.
So the book is called From Both Sides of the Curtain, and it's available wherever books are sold. And it's just my journey from literally it starts the day I diagnose, and then it just kind of takes you some of the most memorable 6 months of my life, and even beyond. But For someone who used to be pretty closed off, I have to say it very vulnerable.
That's
I
okay.
like that.
People, Brene Brown will tell you that's the best thing you need to do is be vulnerable, right?
Yeah.
People they just want to make a connection at the end of the day. That's what life's purpose is really all about. It's making a connection. All right, that's great. Two final questions. I can't leave this conversation for all of those women listening without asking you three things you would say to women to ensure that they put their best foot forward to prevent breast cancer.
First thing, get your mammograms. I'm going to tell you, I know there is a lot of information out there on social media that questions the value of a mammogram. Um, we are at a day and age where breast cancer can be treated easily if it is caught early. Do not wait, get your mammogram starting at the age of 40.
Okay.
The next thing is lifestyle is very critical to preventing breast cancer. So what this means, you need to make sure you prioritize you and take time and eat well. Don't eat things out of a package. Ultra processed foods are not great for us. You want to get great nutrition, whole food. You want to exercise. I know we don't have time to exercise, but it is really important. 30 minutes a day will make a world of difference. So prioritize yourself and your health. And along those lines, and I was kind of of this mindset too, because I'm naturally very slender and assumed I was healthy, but thin is not healthy, fit is healthy. And doing things like nutrition um and exercise are going to be what makes you fit. And then the last thing I would tell anyone out there is focus on stress. We really got to figure out a way to get our stress levels down. And even though, like, when I talk about life before cancer and how I was literally running around like a chicken with my head cut off, I can
Yeah.
do it,
Yeah.
you know?
Yeah. We all do that as when we want to be perfect and please everyone. So I think that's great. I think there are three great points. I really acknowledge you for how you've come out of this before and after. I know that you're doing well. I asked you prior, and you said your health, you're doing well. That is the most important thing. And I thank you so very much for sharing your story today of courage, inspiration, and actually education for other women. Listen, ladies, if you like this podcast, if you like this story, if you really feel like this is bringing value, again, let's make a ripple effect together. Today, we had a wonderful guest on. Go on, share this podcast. Make sure you rate it. You give it a 5 stars. It's going to help other people find it. We listened today to Dr. Sue, and she told us how she did it. And let me tell you, anything in life, you can do it too.
If you want to learn more about our guest, check out the show notes. And please take a moment to write a positive review about the show on Apple or Spotify, because this is the best way for bold women to find this show. To write a positive review, scroll down to the bottom of the podcast and click where it says write a review. In return, you get good karma and a shout out on a future episode. Until next time, my friends, keep pushing through that fear and making your future yours. You've got this.